Welcome everyone, and thank you for being here. I'm Dr. Shin. Today's session is designed to help you develop a deeper understanding of your gut health from a root cause perspective, so you can feel more informed and empowered in your healing journey. We'll start by going over what dysbiosis actually is and why it matters, not just for digestion, but for your immune system, inflammation, and overall health like IBS, IBD, which stands for irritable bowel disease, and overgrowth patterns like SIBO or SIFO. We'll also spend time on what actually drives these imbalances, things like diet, stress, medications, and gut barrier health, so that we understand the why behind symptoms. You'll also learn how we evaluate gut health, combining testing with your clinical picture, and most importantly, how we approach treatment in a more personalized and sustainable way. So by the end of this, the goal is for you to walk away not just with information, but with a clear framework for how to support and restore balance in your gut moving forward. All right, so gut dysbiosis refers to an imbalance in the gut microbiome, the ecosystem of bacteria and other microbes living in your digestive tract or our digestive tract. This imbalance can show up in a few ways: an overgrowth of harmful microbes, a depletion of beneficial microbes, or a general loss of microbial diversity. But what's most important to understand is that dysbiosis isn't just about which microbes are present, it reflects a deeper issue in how the body is regulating the gut environment. Factors like immune function, digestion, inflammation, and even stress all influence this balance. So when we see dysbiosis, it's often a signal that the body's internal regulation of the gut has been disrupted, not just a simple microbial problem. So let's zoom out and look at a bigger picture, what we consider a healthy gut versus dysbiosis. In a healthy gut, or what we call eubiosis, there's a good balance and diversity of bacteria. You have a strong, intact gut lining. Your immune system is well regulated, not overreacting or underreacting, and digestion works efficiently. So you're breaking down food properly, absorbing nutrients the way you should. On the flip side, with dysbiosis, that balance is disrupted. So you might see reduced diversity or an overgrowth of certain microbes. This often goes hand in hand with increased inflammation, a weakened gut barrier, sometimes referred to as leaky gut, and disruption in digestion and immune signaling. So it's not just about the bacteria themselves, but how that imbalance starts to affect multiple systems in the body. So what causes dysbiosis? So dysbiosis usually doesn't come from just one thing. It's typically a combination of factors. Diet plays a big role, especially high sugar, processed food, and low fiber intake. Medications like antibiotics, but also acid blockers and NSAIDs. Chronic stress is another big one. It affects gut motility and immune balance. On top of that, immune dysfunction and damage to the gut lining can make it harder for the body to regulate microbes properly. Underneath all of this, we often see increased oxidative stress and even more oxygen in the colon, which actually favors the growth of less beneficial bacteria. So overall, it's really a breakdown in the natural relationship between your body and your gut microbes. And dysbiosis can show up in a few different forms depending on where the imbalance is happening and what type of microbes are involved. You might hear terms like SIBO, which is bacterial overgrowth in the small intestine, or LIBO in the large intestine. There's also SIFO, which involves fungal overgrowth, and IMO, which is related to methane producing organisms. In reality, these often overlap. They're not completely separate conditions, but different expressions of the same underlying imbalance. And the symptoms of dysbiosis can vary, but some of the most common ones are bloating, gas, and abdominal discomfort. You might also see changes in bowel habits like diarrhea or constipation, along with food sensitivities. Beyond digestion, people often experience fatigue or even skin issues. In more severe cases, dysbiosis can affect nutrient absorption, leading to deficiencies, anemia, or poor protein digestion. So it can really go beyond just the gut symptoms. And dysbiosis, like we just said, doesn't just stay in the gut, it can impact the whole body. On the digestive side, it's linked to conditions like IBS, which stands for irritable bowel syndrome, and IBD, which stands for irritable bowel disease, like Crohn's and ulcerative colitis, and C. diff infections, and even colorectal cancer. But we also see broader effects, including metabolic conditions like obesity and diabetes, autoimmune disease, heart disease, and even brain-related symptoms like anxiety or mood changes. And this is largely due to that gut-brain axis and how connected the gut is to other systems. So how do we test for dysbiosis? So testing for dysbiosis can be a bit challenging because everyone's microbiome is unique. Common tools include stool testing to look at the microbiome and breath testing to evaluate for things like SIBO by measuring gases like hydrogen and methane. Some research shows that dysbiosis patterns are much more common in people with IBS or IBD compared to healthy individuals, but overall, testing always needs to be interpreted in the context of symptoms. The GI map is a stool test that we commonly run here at Sklar Center. And it is a stool test that looks at microbial DNA in your gut using a technology called qPCR. It can detect bacteria, viruses, parasites, and fungi and gives us a detailed picture of your gut microbiome. It looks at beneficial bacteria, opportunistic bacteria, and true pathogens, as well as things like yeast overgrowth and H. pylori. It also measures markers for inflammation, immune activity, digestion, and gut barrier health. And this makes it helpful for identifying imbalances and guiding more personalized treatment plans. And that said, it's important to remember this is just a snapshot in time, and detecting DNA doesn't always mean something is actively causing disease. It's a useful tool, but always needs to be interpreted alongside your symptoms and overall health picture. Treatment for dysbiosis isn't just about killing off bacteria, it's really about restoring that balance. We usually start with diet, increasing fiber and plant diversity while reducing sugar and processed food. Then we also support beneficial bacteria with probiotics and prebiotics. If there's an overgrowth, we may use targeted antimicrobials. And at the same time, we work on repairing the gut environment, supporting the gut lining, reducing inflammation, and addressing stress and other lifestyle factors. And in more advanced or specific cases, therapies like fecal microbiota transplant can be considered, especially for recurrent infections like C. diff. So leaky gut is something that we hear a lot these days, and leaky gut is a common term for increased intestinal permeability. Basically, the gut lining becomes less selective, allowing things like bacterial fragments, toxins, and undigested food particles to pass into the bloodstream. And it's important to clarify that increased permeability is a real measurable process, but leaky gut syndrome itself isn't a formal medical diagnosis. It's better understood as one piece of a larger picture rather than a standalone condition. And so normally your gut lining is designed to be selectively permeable. It lets nutrients in while keeping the harmful substances out. It does this through several layers of protection, a mucus layer that acts as a shield, tightly packed epithelial cells, tight junctions that act like gatekeepers, and the immune system that monitors and responds to threats. All of these work together to maintain that strong barrier. And so when the gut barrier is disrupted, those protective mechanisms can start to break down. Tight junctions can loosen, the lining cells can become damaged, and more substances can pass through than they should. This matters because things like bacterial toxins can enter the bloodstream and trigger immune activation and inflammation. Over time, this can contribute to ongoing symptoms and even chronic conditions. There are several factors that can weaken the gut barrier. Chronic stress and intense physical stress can both play a role. Certain medications, especially NSAIDs like ibuprofen, can also contribute. And gut imbalance itself, like dysbiosis, is another key factor. Diet is another huge factor, particularly highly processed food, high fat diets, and certain additives like emulsifiers and binders. And for some individuals, components like gliadin and found in gluten and wheat products can also increase that permeability. And increased intestinal permeability has been observed in certain conditions like IBD and celiac disease, as well as in situations of severe physical stress. There's also growing research suggesting it may play a role in broader inflammatory conditions, although this area is still evolving. So we think of it more as a contributing factor rather than a direct cause. And how can we support the gut barrier? Supporting the gut barrier involves both nutrients and microbiome support. Nutrients like vitamin A and D, they help regulate immune and barrier function. Zinc supports the integrity of tight junctions, and glutamine serves as fuel for gut lining cells. Short-chain fatty acids, which come from fiber, are also very important for strengthening the barrier. On top of that, maintaining a healthy microbiome with probiotics can help protect and regulate the gut lining. And so I'm going to go over some of the more common symptoms of that's related to gut dysbiosis and leaky gut. And so the first one is irritable bowel syndrome. So IBS is a very common condition, and it's what we call a functional gut disorder, meaning nothing is structurally wrong, but the gut isn't functioning the way it should. Patients often experience symptoms like bloating, abdominal discomfort, and changes in bowel habits, whether that's diarrhea, constipation, or alternating, so both. A key feature is that symptoms often improve after a bowel movement. And IBS is driven by several factors, including the gut-brain connection, stress, gut sensitivity, and sometimes an imbalance in gut bacteria. That's why triggers can vary widely from person to person. So things like certain food, stress, or even hormonal changes can play a role. And the important takeaway is that IBS is often chronic, but very manageable, and treatment really works best when it's personalized. And diet is really the foundation of IBS management. The most evidence-based approach is a low FODMAP diet, which involves temporarily reducing certain fermentable carbohydrates that can cause gas and bloating, and then you gradually reintroduce them. And in addition, simple habits can also make a big difference. Eating regular meals, staying well hydrated, and limiting triggers like caffeine, alcohol, and carbonated drinks. And fiber also matters, but type is very important here. Soluble fiber like oats tends to be very helpful, while insoluble fiber like bran can sometimes worsen the symptoms. And because unmanaged stress can definitely worsen IBS symptoms, focusing on mind and body therapies such as exercise, yoga, meditation, massage, counseling, biofeedback, those are all very equally important. And the irritable bowel disease, so that's different from IBS in that it actually involves inflammation in the digestive tract. This includes conditions like Crohn's disease and ulcerative colitis. And patients often have way more severe symptoms, such as persistent diarrhea, bowel movement frequency, abdominal pain, sometimes blood in the stool, along with fatigue or unintended weight loss. And IBD is driven by an overactive immune response, along with genetic and environmental factors and changes in the gut microbiome. Because there's true inflammation and potential tissue damage, it's important that IBD is properly diagnosed and medically managed. And the goal of treatment here is to control that inflammation and keep the condition in remission. And diet is also a key part of managing IBD, with the Mediterranean diet being the most widely recommended approach. It focuses on whole, unprocessed food, plenty of fruits and vegetables, healthy fats like olive oil, and lean proteins, while limiting processed food, added sugars, and red meat. There are also other dietary approaches that can be useful on a case by case. For example, the specific carbohydrate diet and the Crohn's disease exclusion diet can be also helpful, but they're a little bit more restrictive. And the low FODMAP diet can be used, but only short term and mainly for IBS-like symptoms, just because long-term use of that can reduce beneficial bacteria. And moving on to SIBO and SIFO. And so SIBO and SIFO are both forms of gut dysbiosis, where too many microbes grow in the small intestine, an area that normally has relatively low levels of microbes. With SIBO, the issue is bacterial overgrowth, and these bacteria can ferment carbohydrates and produce gas, leading to symptoms like bloating, gas, abdominal discomfort, and changes in bowel habits. And SIFO, on the other hand, involves fungal overgrowth, most commonly candida, and it's less well known and it's harder to diagnose, but symptoms can look very similar. And the key point here is that symptoms overlap a lot, and in many cases, patients can have both at the same time. So SIBO and SIFO tend to share that same underlying cause, and one of the biggest underlying cause is slow gut motility, when food and bacteria are moving through the small intestine efficiently. And other contributors include acid suppressing medication like PPIs, overall gut microbiome imbalance, prior surgeries or structural changes, and issues with the immune system. So again, it's not just about the microbes, but it's also the environment that allows them to overgrow. For SIBO, the most common test is a breath test. You drink a sugar solution and we measure gases like hydrogen and methane in your breath over time. A rise in the gases suggests bacterial overgrowth, and it is non-invasive and widely used. There is a more accurate and gold standard, which involves sampling the fluid from the small intestine, but it's very invasive and rarely done. And SIFO, there's not a breath test that we can do for SIFO, and so the current standard would be to sampling the small intestine with the fungal culture this time, but again, it's invasive and not commonly performed. So usually with SIFO, we diagnose based on symptoms and clinical history, and sometimes lack of response to SIBO treatment. And additional tests like stool analysis or organic acid tests can also provide clues, but they're not the definitive on their own. And so usually for SIBO, we typically use antibiotics or antimicrobial herbs, along with short-term dietary strategies like reducing fermentable carbohydrates. And just as important is addressing the root cause, so improving gut motility or adjusting medication. And for SIFO, the treatment involves antifungal medication, usually for a few weeks, along with reducing excess sugars and refined carb in their diet, because candida feeds off of sugar and refined carbs. And again, we really need to address the underlying factors to prevent any recurrence. And so for this month, we really want to shift our focus from just thinking about good versus bad bacteria to really supporting your overall gut environment. That starts with diet, prioritizing fiber, plant diversity, so usually rainbow color vegetables and whole foods while reducing sugar intake and processed food. And of course, you don't have to be perfect, but you want the consistency because consistency is key when treating the gut microbiome. And next, you want to think about supporting that microbiome with prebiotics, which are fibers, and probiotic like fermented food and probiotic rich food. At the same time, we want to strengthen that gut lining by making sure you're getting adequate nutrients and minimizing things that can disrupt it. And we mentioned this several times, but stress is also a big piece here. So it directly affects the gut function. So incorporating simple stress management strategies can make a huge difference. And finally, if symptoms are ongoing, it's important to look deeper. So dysbiosis is often a sign of an underlying imbalance. So sometimes testing and a more personalized approach are needed. So ultimately, the goal isn't just to eliminate harmful microbes, it's to restore that balance with your gut ecosystem and also support your body's natural ability to regulate and maintain that long-term gut health. PPI, so those are like for acid blockers. So when you have GERD or acid reflux, PPI is the conventional medication that gets prescribed oftentimes. So like omeprazole is most common one. All right. Any other questions or comments?